주문을 걸어 써버려 슈 Butterfly 처럼 네 맘을 boom 원한 건 싫어 see what I can do 네 앞에 서서 내 마음을 후 So what you do
What is lung cancer? Lung cancer is a malignant lung tumor characterized by uncontrolled cell growth in the lung tissues. If left untreated, this growth can spread beyond the lung through metastasis into nearby tissue or other parts of the body.
There's two types of lung cancer, small cell and non-small cell. Small cell lung cancer is less commonly found. It is 20% only. Metastasis may occur to kidney, liver, and adrenals. Cancer cells grow at a very rapid rate and most of the time spread to other parts of the body at diagnosis. It may be located centrally, mid-lung, or peripherally. Non-small cell lung cancer is the most common type. There's 85% of it. It can grow slowly, and smoking is the major risk factor. First, adenocarcinoma makes up about 40% of lung cancers. It is most often found in the outer part of the lungs and grows more slowly than other types of lung cancer. This type of lung cancer occurs mainly in people who currently smoke or formerly smoked. Second, squamous cell carcinomas. Start in squamous cells, which are flat cells that line the insides of the airways in the lungs. They are often linked to a history of smoking and tend to be found in the central part of the lungs near a main airway bronchus. Third, large cell carcinoma can appear in any part of the lung. It tends to grow and spread quickly, which can make it harder to treat. A large cell known as neuroendocrine carcinoma is a fast-growing cancer.
There are several factors or causes for the lung cancer. First of all, tobacco smoke. It contains harmful chemicals that harm DNA. The chemicals make it more difficult for cells to repair the DNA damage. They also destroy the parts of DNA that protect us from cancer. A buildup of DNA damage in the same cell over time is what causes the lung cancer. Secondhand smoke, on the other hand, is the combination of smoke that comes from a cigarette and smoke breathed out by a smoker. When you inhale it, you are exposed to the same cancer-causing agents as smokers, although in smaller amounts. Next factor is the workplace chemicals. Occupational exposure to arsenic, chromium, nickel, aromatic hydrocarbon, and ether also increases the risk of lung cancer. Furthermore, family history also causes lung cancer. People with chronic obstructive pulmonary disease (COPD) or pulmonary fibrosis are at increased risk. COPD increases oxidative stress, which damages DNA in the lungs, spurring lung cancer. And lastly, pollution. Regularly breathing in particles emitted from vehicles, wildfires, power plants, and more is thought to play a role in developing lung cancer.
According to the Department of Statistics Malaysia, lung cancer is one of the leading causes of death. In the year 2020, lung cancer is the most common cause of cancer-related death, killing over 4,500 people. Lung cancer is recorded as the second most commonly diagnosed cancer, with more than 5,000 new cases diagnosed in 2020. If you take a look at the picture shown, this is what dying of lung cancer looks like. But Tabots was a former smoker. He died at the age of 42 due to lung cancer. He was thus living proof that smoking can cause lung cancer, which eventually leads to death.
Signs and symptoms of lung cancer including fatigue, hoarseness, weight loss and loss of appetite, coughing up blood, sputum, chest pain that is often worse with deep breathing, shortness of breath, and infections such as bronchitis and pneumonia.
If you are suspected to have lung cancer, diagnostic evaluation is performed with the aim to coordinate future treatment. Chest X-ray is often the first test that will be performed to look for any abnormal areas in the lungs. Next, computed tomography, or known as CT scan, is performed. A CT scan is used to make detailed cross-sectional images of the patient body. It can show the size, shape, and position of any lung tumors. Besides, positron emission tomography, or known as PET scan, is also performed. For this test, a form of radioactive sugar is injected into the blood. This radioactive substance can be seen with a specialized camera of the PET scan.
Treatment depends on type, stage of cancer, and lung functional status of the patient. If you have lung cancer, you may need surgical treatment. There are several types of surgical treatment. Firstly, lobectomy. In this surgery, the entire lobe containing the tumor is removed. Secondly, segmentectomy. In these surgeries, only part of a lobe is removed. This approach might be used if a person doesn't have enough lung function to withstand removing the whole lobe. And lastly, pneumonectomy. This surgery removes an entire lung. This might be needed if the tumor is close to the center of the chest.
There are several therapy treatment plans to cure lung cancer. For instance, radiotherapy is a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Next is chemotherapy, which is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. The drugs are taken by mouth or injected into a vein or muscle, which then enter the bloodstream and reach cancer cells throughout the body. Other than that is the laser therapy. Laser stands for light amplification by stimulated emission of radiation. Laser therapy involves the application of low-intensity laser light to kill cancer cells.
Lung cancer can be prevented by several measures. At present, there is no cost-effective method to detect early lung cancer, and patients usually present at a late stage. Thus, the most effective method to prevent lung cancer is to reduce exposure to tobacco smoke, whether active or passive, or secondhand smoke. To those who are still smokers, it is advisable to quit smoking. Limit exposure to carcinogenic chemicals is also advised.